Hello, and thank you for joining me for this briefing on Marburg virus disease. And for this presentation, I'm going to refer to it as MVD. In September of 2024, Rwanda reported the country's first outbreak of MVD. A month later, on October 3rd, the CDC released a health alert. And on January 14th of this year, the WHO issued a notice of another Marburg outbreak in Tanzania, which included 9 cases and 8 deaths. MVD is a severe hemorrhagic fever that can lead to illness and deaths in humans. Ebola and MVD are clinically similar. Both are rare, but have the capacity to cause outbreaks with high fatality rates. In fact, MVD's case fatality rate is about 50%, but it can range from anywhere from 24 to 88%. And MVD was initially detected back in 1967 after 2 simultaneous outbreaks in Germany and Serbia occurred, and these were associated with laboratory work using monkeys. It's also important to note that there are no approved vaccines or antivirals for MVD. So the symptoms of MVD, it could be difficult to clinically distinguish MVD from other diseases like malaria or meningitis or other viral hemorrhagic fevers. The MVD begins abruptly with high fevers, severe headaches, malaise, muscle aches, severe watery diarrhea, abdominal pain, nausea, vomiting. Those are all can begin to occur on the 3rd day. And then between the 2nd and 7th day, a non-itchy rash can also develop. And then on the 5th day, patients may develop the classic hemorrhagic manifestations with the blood, like blood in the vomit and feces, and bloody nose, bleeding from the gums, nose, and vagina. And it could also, involvement with the central nervous system can also result in confusion, irritability, and aggression. In fatal cases, death occurs most often between the 8th and 9th day, and it's usually preceded by severe blood loss and shock. Rosetius aegyptiacus is a fruit bat, and it is the natural host of MVD. The virus is transmitted to people from these bats, and it spreads from human to human transmission. So people who are at risk are people who are exposed to these bats or who are exposed to infected non-human primates. Healthcare workers and laboratory workers are also at risk. And people who have been exposed to bodily fluids of persons who are sick or have died from MVD. And also people who have been exposed to semen from men who have actually recovered from the infection with MVD. Healthcare workers should always take precautions when caring for patients, regardless of their presumed diagnosis. So proper hand hygiene, wearing masks or protective respiratory hygiene, and use of any type of PPE that blocks splashes of infected materials. It's always important to remember safe injection practices and also safe and dignified burial practices. Healthcare workers caring for patients with suspected or confirmed MVD should apply extra infection control measures to prevent contact with those patients' blood or bodily fluids. And samples should be handled by suitable laboratory workers, and because samples are extreme biohazard risks. Laboratory testing should be conducted under maximum biological containment conditions, and all specimens should be packaged using the triple packaging system when transporting the samples. Community engagement is key to successfully controlling any outbreaks. Outbreak control relies on using a range of interventions like case management, contact tracing, and making sure that infection prevention is also key and safe and dignified burials and social mobilization. Please contact me for any additional information, and thank you for your time.